Good afternoon. Thank you for tuning in to the May meeting of the Connected Healthcare Community. So all the group of Bright Good users and beyond, everybody who's involved in that wide spectrum of healthcare, from providers to patients of all kinds and caregivers as well. So thank you for tuning in. We are going to talk today about collaboration throughout the circle of care, and specifically about how chiropractors support the connected healthcare community. As we dive in, I just want to look at this quote that I came across while I was looking at the research around team-based care this week. It's really interesting to hear that collaboration has become an essential competency as we're looking to address increasing quality of patient care and outcomes. So this is a really good conversation to be having now, because it says there's a real need to transform that culture of avoidance. We need to get beyond the isolation of our individual clinics and those silos of data information. We talked before about the Interoperability Saves Lives report that came out in Alberta last year. So this is a really good opportunity for us to talk about that collaboration, and I'm really excited for what our speaker today, Cecilia, is going to have to say about that. So I'll introduce Cecilia real quick, and then I'll let you say hello, Cecilia, or you can say hello now if you want.
Hello, everyone. I'm excited to be here. Thanks, Jeff.
So, yeah, I'm really excited for you to be here, because we've been following very closely what you've been doing in the last year with the association. It's brand new, along with some of the other associations in Alberta, and it's really, I mean, you've been busy. I don't know how you sleep, but I'm sure hopefully you have time for that somewhere along the line, given everything that we've got up here. So, quick introduction: Cecilia is a passionate leader. She's been working at the executive level for 20 years across healthcare organizations, government agencies, working, building relationships really across the spectrum. She's got a Master of Arts in Leadership, a BA in Public Relations, and a Corporate Director certificate, as well as a number of other certifications and memberships and everything that really adds to Cecilia's value on here. Not just that Cecilia's great. It worked for 10 years on the leadership team of the Canadian Patient Safety Institute. So really interesting perspective across the spectrum of care, which is really exciting. And then, of course, Cecilia's got a great personal life too, and a couple of kids, and a husband, and loves food, and all kinds of things that are really good too. So Cecilia, with that, I'll turn things over to you. I'm just going to make you presenter here so that you can go through your slides and what you're going to talk about today.
Thank you so much, Jeff. I really appreciate you having me here today. I'm thrilled to be the inaugural CEO of the Chiropractic Association of Alberta. We were formed in December 2021, post Bill 46, when all associations and regulatory bodies split. So hit the ground running, developing a startup, and it's been an incredibly busy 2.5 years. At the Chiropractic Association of Alberta, we're a small but mighty team of 5, and we are led by a strategic oversight board, which is a complement of 12 board members, all chiropractors in nature. So they're all practicing chiropractors in Alberta. And they have done an incredible job of starting the association from an operational perspective, but then handing over the reins from a strategic oversight perspective and truly leading a vision for the 1,200 chiropractors that are practicing in Alberta. So I'll dive right into our strategic plan. We have a duty to diagnose and a commitment to care. And when we established our strategic tagline, it was incredibly intentional, because our first priority as an established association was to regain publicly funded diagnostic imaging on behalf of our chiropractors. And I'll speak more to that shortly. The commitment to care is also incredibly intentional, because we know how much chiropractors care. On average, the first initial visit is an hour in length, and we find that chiropractors are with their patients for a long time within their healthcare journey. So commitment to care is also incredibly intentional. Our why is we want to be integral to primary care, to Albertans' primary health care. What we mean by that is we know chiropractors are an underutilized resource within the continuum of care. As MSK experts, on average, chiropractors have 8 years of education, generally an undergrad in something kinesiology-based, and then a 4-year doctorate in chiropractic. With the integral to Albertans' primary health care, we know that every 60 seconds an Albertan is presenting to primary care or to acute care with something MSK related. And interestingly enough, Stats Canada data is showing us in Alberta for arthritis and chronic back pain, 80% of Albertans consult a primary healthcare provider first, but second to that is chiropractors. It's at 17.6%, so it's quite a bit lower. And we're working very hard to bridge that gap to position chiropractors as integral to primary care in Alberta. We have 3 strategies that we're going after. Our first one is enabling world-class care to spine, muscle, nerve, and joint conditions. And when we say world-class, we don't take that lightly. We're on the cusp of launching a national patient safety strategy for chiropractic to measure unintended harm. And we're really working hard to ensure that all of our chiropractors are working to the highest level of evidence-based care. We want to work on expanding scope and utilization. Predominantly right now, we're working on that utilization component of ensuring that chiropractors are part of that interprofessional collaboration and Albertans' medical neighborhood or medical home. And then our third is we never take for granted that we are a member-based association and we want to add value to our members and to, optimize the practice life for our members and add value to patients. So really working for that health and well-being of Albertans. Our how is simple. We want to promote and advocate, like today, on the imperative role that chiropractors play within the healthcare ecosystem of Alberta. And we're doing that with advocating to patients, government, healthcare professionals, and insurers on the role that chiropractors play. So I'm going to touch on a little bit of the advocacy work we've done to date. As I mentioned, one of our #1 goals on the onset of establishing the association was to regain publicly funded diagnostic imaging for chiropractors. And we had a multi-pronged approach to do this. Our first step was to commission an Ipsos public opinion poll, and 82% of Albertans told us that they believe in chiropractors having access to diagnostic imaging. We worked very closely with the Alberta Medical Association, and we were thrilled to garner the support of the Alberta Medical Association. Not only did they support our plight in regaining publicly funded diagnostic imaging, but they went as far as to send a letter of support to Minister Copping, who was the health minister at the time. We took the Stats Canada data that I just referred to, and we compiled a report on building the case for publicly funded diagnostic imaging for chiropractors in Alberta and submitted this, and we were thrilled. The little graphic on the right is the tweet or the X that the Alberta Health put out in September 2022, announcing that we had once again regained publicly funded diagnostic imaging. So a huge win for our 1,200 members. Some of the other advocacy work we've done is we submitted a proposal to the Minister for the Modernization of Primary Care, and we were thrilled to see when the final report came out, chiropractors were mentioned in 3 of the recommendations as part of that interprofessional team-based care. And now that's something we're working incredibly hard at for ensuring that chiropractors are at the right tables and part of that continuity and community of care like we're talking about today. We did a Hill Day in November 2023. We were thrilled to spend the day at the Alberta Legislature. We had great conversations with the Minister of Health. We also had a chance to connect with the Ministry of Seniors and Social Services, as well as the Ministry of Mental Health and Addictions. All Albertans receive $250 of chiropractic funding through Alberta Blue Cross. So we know that there's a huge role for chiropractors to play within the aging population. And as far as the Ministry of Mental Health and Addictions, we know that with chiropractic being a non-pharmaceutical intervention, it really helps mitigate the amount of opioid use in Alberta. So talking with the role that chiropractors can play within pain-based care. Our other advocacy is working with the Superintendent and Deputy Superintendent of Insurance for the MBA protocols. We've been doing a lot of work with the Insurance Bureau of Canada. And of course, we have just under 500 WCB providers in the province. So we work closely with WCB for ensuring that we create a robust relationship with that incredibly important stakeholder. And we were thrilled to provide feedback as well to the diagnostic treatment protocol which we were at the table with and just helped develop the new guidelines that were issued. The Alberta Medical Association has been incredibly important to us. We know that we have to get Alberta's 14,000 doctors on board for the role that chiropractors play. And I'm thrilled to say we've had great relationships with the 3 past presidents that have been in existence since we've been established as an association. We just had Dr. Paul Parks and Cameron Plith at our board meeting talking about positioning the role of chiropractors within primary care and within the interprofessional team-based care. And we have Dr. Parks presenting at our conference in September. So we can't say enough about the AMA and how valuable they've been in working with us and supporting us for how we can position chiropractic care. Some of the member resources that we have, we know chiropractors need to have good testimonials that they can showcase and share to tell the story of what chiropractic care looks like for patients. So here's a little vignette that we have on our YouTube channel with Dr. Sean Williams, who practices at a bell tower in Edmonton, and she shares the story of Audrey, who's a chiropractic patient that she's been treating for quite a few years, and this Audrey's story of health and wellness. We also did some journey mapping, not only with our members, but with Albertans to find those pain points that they're experiencing as a chiropractor or as a patient of a chiropractor. And we use this innovative tool of journey mapping to be able to address what tools and resources we need to showcase in order to ensure that we're an incredibly robust association. From a chiropractic perspective, it was how do you simultaneously be a chiropractor and a business owner at the same time? So our members want resources in order to support their practice life. And for patients, we heard the continuity of care was incredibly important to them. So they want chiropractors to be engaging with primary care physicians to be able to share the care journeys that they're experiencing, or any other allied health professionals that are part of their team. We have a conference every year. We rotate it between Edmonton and Calgary, and we have incredibly great speakers who have joined us. This year, we're really excited to have the chiropractic team that provides all the care to the Canadian Rodeo. And we have the Edmonton Oilers chiropractic team and physician who will be closing out the conference. And we'll be sharing the story of Connor McDavid and how through chiropractic care, he was able to rehab his knee through a non-surgical intervention and showcase that story. So we're really excited about our conference that's coming up in Edmonton. We have a repository of all chiropractors in the province, our Alberta Chiropractic Directory. It's established as a bit of a heat map in the Find a Chiropractor, so you're able to click and see all chiropractors in the province, the care they provide, whether it's acupuncture, active release, or dry needling, and where they're located. So that's where we encourage all of our campaigns to visit, is our Find a Chiropractor directory. Speaking of campaigns, we focus on a few. We're thrilled each year that we have a Toasty Toes drive, which this year we were able to collect almost 17,000 pairs of socks for Albertans that are in need. And we were actually, because of this campaign, up for an award through the United Way. So it's sort of our act of caring and giving for Albertans. Our other campaigns include World Spine Day. So on behalf of the World Federation of Chiropractic, we have a campaign every October. And this year, the theme was Move Your Spine. So encouraging Albertans to, whether they're working in offices or on the tools or bending over patients as a dentist, get up and move your spine so that you can really ensure that you keep your MSK health where it should be. The other campaign we did that was incredibly popular was Why Wait to Feel Better? So this was talking about all of the types of patients that see chiropractors, whether you're an active parent, a skier, or an office worker, and the role that chiropractors can play in ensuring that you're taking great care of everything spine, muscle, nerve, and joint related, and the role that chiropractors can play in that. And this campaign actually did win an award, which we're thrilled about. We did something called chiropractic conversations. So we know that we have some perception challenges ahead of us, and we really wanted to hear, what do Albertans think about chiropractic care? What do allied health professionals think of chiropractic? And what do physicians think of chiropractic? We ran a digital ad campaign that's asked Albertans to participate in a 90-minute session to share their opinion of chiropractic. And we had 90 Albertans that responded for this discussion. So we had 6 focus groups in total, and the key themes that we heard about were patients want choice and self-determination of care. They want to feel that they have agency over their own care and the ability without judgment to work with a range of interprofessional professionals, interdisciplinary professionals to find the best combination of treatment for their care. So the trifecta of care is generally physio, chiropractic, primary care, or chiropractic, massage, physio, whatever it ends up being in order to get you back on your feet and back to work sooner. We also heard that Albertans want a team-based approach to care. They want to ensure that the restructuring of healthcare in Alberta will provide opportunity for a broader-based commitment to collaborative interprofessional care. So the good news is I think in all directions we're heading in the right one, and we will see that interprofessional collaboration at the table. The other piece is chiropractors. They want chiropractors to have access to provincial systems. So you'll hear me speak about this in a minute, but we have a goal of getting 65 to 75% of our members connected to Netcare by the end of the year. So we've been working closely with Netcare on this, closely with Bright Squid from the PIA perspective. But we really want to ensure that we have one consistent electronic health record and then eventually the EMR. And we have a really neat pilot under works for output measures to be able to showcase the impact that chiropractic has. The provincial funding framework also came up. So we are in an advocacy role right now to try and get some Alberta Healthcare Insurance Plan funding for chiropractic care. Historically in Alberta, there has absolutely been funded chiropractic treatments, and we'd like to see this happen again. In current state, Albertans who seek chiropractic care are doing so through insurance, through benefits, coverage, or paying out of pocket. So this is something that we really want to look at, taking the burden off for patients with getting some Alberta Healthcare Insurance Plan funding. The recommendations that came out for our next campaign, which we'll hopefully be launching in the next week or two, is we need to be more cognizant of informing Albertans how thoroughly educated chiropractors are, that they do have 8 years of education. And then the fundamentals of scope of practice, so the range of care that chiropractors can play. Shoulders, hips, knees, it goes beyond back and neck, so all of the treatment that chiropractors can play. And then the other one, which ties very nicely into our national patient safety strategy, is the assurance that the standards of care are in place and a national commitment to safety culture through evidence and research. The other piece to this is really showcasing that chiropractic care is a regulated profession, and all chiropractors in Alberta do have to have a license in order to operate. Some of the priorities that we have on the table for this year, it's crazy that 2024 and you think it's almost June. But as I mentioned, we submitted a proposal to the minister to get some Alberta Healthcare Insurance Plan funding for originally Albertans with low back pain. So we're looking at ways we can explore this for ensuring that anyone who's experiencing chronic pain would be able to seek chiropractic care, no matter their socio or economical status. The pilot that I alluded to is the SelfBack pilot. So SelfBack is an app generated out of Denmark. It uses AI to provide self-management care for patients who are experiencing low back pain. So we're thrilled to partner with the University of Alberta from the research side of launching this pilot. We have 15 chiropractors that will go through a 6-month pilot in using SelfBack with their patients. And they'll be able to monitor and course correct the treatment plans through the app using AI to see what works effectively for treating low back pain. So we're really excited to see the output measures that this study garners, and we'll absolutely share those. We have the MSK clinical pathways. So through the Alberta Health Services Strategic Bone and Joint, there's the low back care pathway that we're rolling out to all of our members in the upcoming year. And this is in support with the Alberta Bone and Joint SCN. So we're really excited to see the results that this garner for consistent care. And I'm on the tail end of doing a roadshow where I've been able to connect with 30 out of the 39 executive teams of the PCNs across the province. This has really helped us pinpoint some key themes, and we know we have an awareness building exercise ahead of us for really showcasing the work that chiropractors provide Albertans. And we've been able to pinpoint a couple of really great opportunities for collaboration for getting chiropractors as part of the enhanced healthcare team within the PCN model. So this has been a great exercise for us to just learn perception and then looking for those opportunities of collaboration. We have just established a physician engagement task force, and we know that the physician engagement is on us. It's on our members to truly engage effectively with physicians across Alberta. So this task force will help pinpoint how we do effective referrals, how we do that effective communication back and forth with physicians within the province. And we're really excited to be releasing the toolkit in July that can help with the physician engagement for our members. And as I mentioned, we have a big goal to get eventually all of our membership connected to NetCare, and then hopefully eventually ConnectCare, depending on how that plays out. But we know that this will absolutely help with the continuity of care for Albertans to have all of our members accessing all NetCare components that are within scope. And that is the round the world tour of the Chiropractic Association of Alberta. So I've left our contact information on the screen as well if there's any questions that you have that you'd want to take offline. But I know, Jeff, we also have an opportunity to answer some questions online today. So with that, I'll pass it back to you, Jeff.
Great, Cecilia, thanks so much. A thorough and very interesting presentation. I learned a lot. We do have a couple questions we'll get to. Before I move on to that, here are a couple of resources that you can follow up on. There's the association website, albertachiro.com. You can also follow the CAA on LinkedIn at Chiropractic Association of Alberta there. The quote that I threw up at the beginning there is from a research paper. You can find it there. I'll send out the link, or we'll post that link in our blog post once we get the recording up. So we'll send that out to everybody once we're done with that. And just a quick note here, you can search the directory in Brightsgood for any profession, really. If there's somebody that you would like to speak with, or want to refer a patient to, or have a question about, you can always do the search in your directory. There are 12 or 13,000 different healthcare professionals in the directory within Alberta alone. And then globally, there's about 100,000 different professionals. So you can search by city. It'll automatically default to your region, your province, or your state. And then there's a drop down where you can select the type of provider, and it'll show you everybody that's listed in there. So if you want help, it's a good place to start when you're looking for anybody. And you know that if they're there, you can send them a message. We do have a couple of questions to get to. We have about 5 minutes left in our schedule, so I think we can get to a couple of them. But the first one, and you did kind of mention this, Cecilia, is that is there a place online, like Find a Doctor for chiros? So if a clinician or a clinic wanted to find a chiropractor for their patient who's got a presentation, one of those once every 60 seconds presentation. That was a really interesting statistic. I had no idea. But if a patient comes in with a presentation that's relevant, what's the best way to find somebody?
Great question. So there's two repositories that I'd refer to. We have one on our albertachiro.com website where we have Find a Chiropractor, which is a heat map, and you're able to pinpoint where the chiropractor is located. And then another great reference is also the college website. So the ccoa.ca, so the Chiropractic College of Alberta, they also have a repository of all licensed chiropractors in the province as well. So there's two great websites that you can refer to.
Perfect. That's great. Thank you. And then, like I said, you also have the directory if you want to find somebody there too. But obviously the Chiro website is the best place to start. Next question is, are there incentives in place that encourage working with chiropractors?
The only true incentive would be helping your patients get back on their feet and back to work sooner from a non-pharmaceutical intervention. So we have to do a better job of capturing output measures within chiropractic care. So we are working on establishing some good data capture to be able to pinpoint, because of chiropractic intervention, here were the outcomes. So
Great.
not specifically, Jeff, the incentives, but I think it would come down to the health and well-being of Albertans. And because of chiropractic care, we do know that Albertans are able to experience shorter absence of pain, shorter leaves from work, whatever it comes down to from an MVA or WCB perspective.
Yeah, that's a really good point. I was gonna kind of echo that. We tend to sometimes get stuck thinking within our own profession. I think sometimes with different specialties within, physicians or dentists or any number of professions, and kind of refer within that cohort. And we've seen ourselves working with different clinics. We work with a large spinal surgery clinic in Calgary, and we helped them get their wait times down from about 2 years to about 3 months.
Wow.
Partly because we were identifying, and they were identifying through the service that we provided them, they were identifying that patients didn't need to stand in line for 2 years for spine surgery. They needed physio or chiro care. They needed something, like you said, non-pharmacological, somewhere that they could get the physical care that they needed so that they could move forward. And what they found was that as many as roughly 50% of the cases or more that were being referred to them were more appropriately served by another member of the whole care team, and when we're looking at the entire spectrum. So I think you did a really good job of painting that picture of where chiropractors fit. So hopefully people have a better understanding now of what sorts of presentations make sense to go to a chiropractor versus, maybe another doctor, or looking at simple, like, pain medication or something that we can avoid if we have the right provider in
Yeah,
the network.
that's an excellent anecdote. And actually, I was in at a presentation in Toronto a couple weeks ago, and I was speaking to a chiropractor who's running the rapid access clinics through Hamilton Health. And he had a very similar statistic that within their surgical centers, 90% of the patients we were seeing did not need a surgical intervention. They actually, through chiropractic treatment, were able to avoid surgery altogether. So,
That's
yeah,
amazing.
some really powerful stats out there.
Well, and thinking about, and you're headed down the path clearly, and I know this is on your mind, but it's that concept of how do we alleviate the burden on the healthcare system, right? How do we share that weight? And I think what how the Chiropractic Association is set up and how chiropractors are progressing in Alberta and in Canada to help step up and take on some of that load. Like you said, we end up kind of sending people to the wrong place when there's other places that are more appropriate. So this awareness is really, really important, and I think it's really impactful. So that brings us to our time. Thank you very much, Cecilia. I really appreciated your contribution today. Very, very thoughtful presentation and super informative. I'm really looking forward to attending the conference. Any final words before we go?
Just thank you, Jeff, and thank you to everyone at Bright Squid and all of the Albertans who are working hard to provide exceptional care. Thank you so much for having us.
Have a great day, everyone. Bye now.